Hey, I'm Brandon. We're going to talk a little bit about capabilities of an HH-60 mic helicopter and just basic helicopter safety and operation. HH-60 mic Blackhawk, we got 12 of these in the state, and some of the capabilities that we're known for is our mountain rescue. We got our rescue hoist up here. We can lift 600 pounds, 300 feet up. Takes about a minute to pull all that cable up with a normal person, and we usually haul them up in a Stokes basket, just normal, get them on a backboard, lay them in, strap them in, hook it up to the hook, and yard it up. Another thing we can use is a sked, and it's pretty much once you package them on a backboard, you roll them up like a plastic burrito, and then we'll hook them back up to the hook. Some of the other things that we do have on the helicopter is we have an onboard oxygen generator, so we can actually go up to 15 liters a minute on 6 patients. Right here we have onboard suction, and what we can do is we can actually haul 6 patients, 6 litter patients. We got 2 litter pans right here, and we'll load one up, raise it up, load the next one, raise it up, and then throw the third one on the floor. We can do that on both sides. This one is rigged up for litter on this side and ambulatory on this side. So if you can walk in, get in, you sit right over there in the seats. We can go about 2.5 hours on gas. One of the limiting factors of this helicopter is it is so big. 65 feet long, 55 feet wide for rotor, and up to 22,000 pounds. We can only land at OHSU, Legacy, Emmanuel, and down at River Bend in Springfield. Everywhere else we usually got to find somewhere close to the hospital and land, or an airport, transfer to an ambulance, haul them in that way. Basic safety on the helicopter. Number one, I always want to stay away from the tail rotor. Luckily this one, it is high enough that you're probably not going to get whacked by it. And there is a giant wing right here that hopefully that'll block you. One of the things we talk about with the Army guys is when you come up 3 o'clock or 9 o'clock, most importantly you're going to want to talk to the crew chief, or in civilian, get the flight nurse or flight paramedic. They'll tell you exactly how they want you to load up. But we always tell them, hey, go right to the cross, because that is going to give you about the best angle, or best clearance from the blades. Once we come in, kind of come in. You always come in with the feet first in the Blackhawk, because I have all my oxygen. I've got my power supplies in case I need to hook any other monitoring up. This head's right here, and the crew chief and the medic are sitting in the back, so we don't want to be sitting all the way, or have the head all the way up in front. So that's basically the Blackhawk, and in just a minute we'll show you the Lakota.